Good morning and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Sharon Zinkler. Thank you, Sharon, and thanks to everyone for joining us. Over the past week, cases have increased and the number of people hospitalized remains high. The risk dial will be staying in red. It's critical that we continue to take action to help preserve access to our hospitals and healthcare, keep our schools open, and reduce disruptions in business services. Here is what we should all be doing right now. Stay home except to go to work or school, to buy food or get medical care, or to get tested or vaccinated. Mask up indoors. Get vaccinated or boosted now. Avoid crowded situations and don't attend big events like concerts or athletic events. Get tested if you have COVID-19 symptoms or have been exposed to someone who has the virus. If you are sick, stay home and away from others. You may be hearing that Omicron is peaking or retreating in some areas of the country, and that is really welcome news. However, Omicron has not yet peaked here. When it does, the threat is not over and we cannot afford to let down our guard. Even when the case numbers start to decline, the risk of infection will still be high for at least a couple of weeks, and hospitalizations could continue to increase. We still need to help our hospitals and schools get through this surge. Let's take a look at our local situation. The number of new weekly cases increased for the fourth consecutive week, as you can see on this chart. More than 4,500 new cases were reported locally for the week ending January 22nd. That was a small increase over the previous week of over 4,400 cases. However, some testing locations were temporarily closed last week, so the total case numbers may not be fully reflected. Almost all age groups have been impacted, but over the past 2 weeks, young people have experienced a larger increase in cases. Those 18 and younger made up about 30% of all new cases last week, and those aged 10 and under accounted for 671 new cases last week. That is more than double the number from just 2 weeks ago at 303 cases for the week ending January 8th. It is also evident that there is still a high risk of transmission in the community due to the extremely high positivity rate, which was 30.7% at the end of last week. Our hospitalizations have been increasing since November, and on this chart you can see that the average weekly hospitalizations remained high for the previous week at 132. This data metric has been in red for 4 straight weeks now, and our hospitals continue to be strained. Unfortunately, the number of patients is high again today. The hospitals are reporting 138 COVID-19 patients, with 98 of them from Lancaster County. We are also sad to be reporting one COVID-19 death this morning, a man in his 60s. And sadly, we have lost 30 members of our community so far in 2022. When we're talking about the number of local hospitalizations, that number does include children. The CDC shared yesterday that COVID-19 hospitalizations for children and teens in the U.S. are currently at an all-time high. Joining us today is Dr. Amy Pinkel, Associate Division Chief of Pediatric Hospital Medicine at Children's Hospital and Medical Center. She is also the Medical Director of the Lincoln Pediatric Hospitalist Program. For those unfamiliar with the term, a hospitalist is a physician who provides care to patients in the hospital. Dr. Pinkel will share more information on what she's seen related to children and COVID-19. Dr. Pinkel?
Thank you, Director Lopez. As you said, my name is Amy Pinkel. I am a pediatric hospitalist here in Lincoln, and so I work taking care of kids in the hospital, so I have direct access to these kinds of patients on a daily basis. And I'm glad to be here today to talk about what we're seeing. So as you know, I think throughout pandemic, the role that we've seen kids playing has been downplayed. We've heard a lot of kids don't get sick, kids don't get severe illness. Unfortunately, the truth is that kids are getting sick, kids are getting hospitalized. We've seen the rates of illness and hospitalization both increasing over recent months, and that's happening right here in Lincoln. We've had kids in the hospital anywhere from newborns all the way up to teenagers, and most of these have been healthy kids without underlying chronic conditions. It is true that kids can have mild illness or even asymptomatic illness, but they definitely also are getting hospitalized with moderate to severe illness. The kinds of things that we're seeing in the hospital can vary. We're seeing very typical respiratory infections with pneumonia, needing oxygen, being short of breath, that sort of thing. Abdominal pain, vomiting, diarrhea, dehydration. We also, more recently with Omicron, have seen a lot of severe croup, and we're seeing it in kids that are older than we would normally see with croup and much more ill than we would normally see with croup. There also is a condition that we are seeing that's called MIS-C that children are particularly susceptible to, and it is a complication kids get after COVID infection. So what happens is a child gets COVID, and it may be that mild or asymptomatic illness, but then a few weeks later they get this multi-system inflammatory syndrome that causes them to have a significant illness with fever and really almost any body organ affected. They can have problems with their lungs, their gastrointestinal system, their eyes, their skin, and it very commonly affects the heart muscle. So it causes very serious illness and usually requires hospitalization, often ICU level hospitalization. So we can definitely say that COVID is affecting children, and it isn't always mild. It's also important for us to note that the vast majority of patients we've seen in the hospital have been unvaccinated. Some of these children are too young to be vaccinated in that under 5 population, but certainly many of these patients could have been eligible for vaccination. As we heard, only about 28% of children ages 5 to 12 in Lancaster County are fully vaccinated. So we need your help in protecting our children. If you or your child are eligible for vaccination or a booster, but you've been waiting, I ask you not to wait any longer. Now is the time. I understand you have hesitancy, you have concerns, you're worried, and you want to do the right thing for your children. But I encourage you to talk to your trusted healthcare provider, ask the questions that you have, get your concerns alleviated, and hopefully proceed with that vaccination. The vaccine is safe, and the vaccine is effective. Also, in children, we've learned that not only does getting vaccinated protect them from severe COVID illness, but it protects them from that MIS-C complication of COVID, which is huge. I'd like to take just a minute to shift and talk about the healthcare system and the effects we're seeing. So here in Lincoln, most of the patients I take care of in the hospital don't actually have COVID. We definitely have them, but that's not what most of the patients are. But the strain that COVID places on the healthcare system affects everyone in the hospital with every illness. So no matter what you're hospitalized for, you're being affected by COVID. And also here in Lincoln, we don't have a pediatric intensive care unit. So if we have those more ill children for whatever reason, we rely on sending them somewhere else and transferring them for care. Usually that's Omaha at Children's Hospital and Medical Center or University or Boys Town. But unfortunately, those hospital systems are also feeling that same strain and have been full frequently and unable to take transfers from us. So we've had to reach out of state for places to send our sickest kids and hold on to kids a little longer maybe than we would like to here in our local hospitals until a bed opens up in Omaha. So we want to do what we can to make sure our kids are getting the care they need and deserve at the time they need it, no matter what their illness is. And we can play a part in this. We can reduce the impact that COVID is having on the healthcare system by doing all those things that Pat mentioned. We can mask up, we can vaccinate ourselves and our children, we can wash our hands, we can physically distance, we can limit our outings, and by doing all these things, we can make a difference for the kids of our community. Thank you.
Thank you, Dr. Pinkel. As you mentioned, the vaccines are safe and effective, and being fully vaccinated and boosted helps protects our children from serious illness and hospitalizations from COVID. We continue to partner with our local pediatric practices to offer COVID-19 vaccine to children. And as Dr. Pinkel said, now is the time to get your children vaccinated. Looking at current vaccination numbers for Lancaster County shows that almost 29% of children ages 5 through 11 are fully vaccinated, and we want to see that number increase. Just over 65% of all Lancaster County residents are fully vaccinated, and 59% of residents aged 12 and up have now received a booster or third dose. Over 12% of those who receive boosters or third doses are 12 to 15 years old, the most recent group eligible for boosters. This week, we're holding more walk-in vaccination clinics at local elementary schools and other locations. This afternoon, we'll be at UNL East Campus from 3 to 5, in Hartley Elementary School from 4 to 6:30. Thursday, tomorrow, from 3:15 to 6 p.m., we're hosting a clinic at Everett Elementary. And we continue to have clinics at the health department almost every weekday. You can also schedule an appointment if you prefer and find more clinic times and locations at covid19.lincoln.ne.gov. All clinics offer first and second doses for 5 and up, Pfizer booster doses for 12 and older, and Moderna booster doses for 18 and older. We continue to urge residents to get vaccinated or boosted now. Vaccination remains our primary tool for preventing severe illness and saving lives in adults and children. And as I mentioned, Omicron has not yet peaked in Lancaster County, and we need to continue taking action to help reduce its impact on our community. Stay home except to go to work or school, to buy food or get medical care, or to get tested or vaccinated. Mask up indoors. Get vaccinated or boosted now. Avoid those crowded situations, get tested, and please stay home if you're sick. The health department, in working with Total Wellness testing site at 1918 O Street, is one of several testing options available in Lincoln. Testing is by appointment only. You can get an appointment the same day. Go to totalwellness.com, Lincoln, to schedule. You can find other testing options at covid19.lincoln.ne.gov. And also, I wanted to update you. Late yesterday, the Nebraska Department of Health and Human Services announced an at-home testing initiative. The Department of Health and Human Services is finalizing a contract with a company that will provide at-home test kits for Nebraska residents. The state will be working with local health departments to determine locations where test kits can be picked up within local communities. We are waiting additional details and information from the Department of Health and Human Services, and we will share more specifics as soon as we learn them. We also wanted to remind you that every household in the U.S. is eligible for 4 free at-home COVID-19 tests from the federal government. The website where you can order these at covidtests.gov. And I know that some of our staff have ordered them and received them, so I encourage you to do so. Whether you're getting tested at a testing site or taking a self-test at home, if you do test positive for COVID-19, you need to isolate. If you're exposed to someone who has COVID-19, you may need to quarantine. And our new quarantine and isolation resources are posted on our webpage at covid19.lincoln.ne.gov. And with that, I'd be happy to take any questions.
This is Ellis with 1011. I just had a question about testing. That new feature on the COVID-19 dashboard, you can sort of see that turnaround time, and that average has been decreasing over the past couple of weeks. Do we think that's coming from either catching up or maybe having more people work in those labs? Or are you seeing a decrease in maybe people getting tested?
The turnaround time is increased. I'm not sure I understood exactly.
Decreasing. Like it's decreased about the time it's taken for people to get those results back has decreased over the past couple of weeks.
Probably because of the number of people getting tested and some of the sites being closed down somewhat, if I understand you correctly. We haven't really seen a decrease in are people being tested, but I know the turnaround times for one of the labs was a little bit longer.
Pat, we have a couple questions from Dale Johnson at KFOR. He's asking, the rollout of free N95 masks has begun. Some Midwest states, including Iowa and Wisconsin, have received some. Has Lincoln received any yet?
No, we actually have not received any, and I appreciate Dale asking that question. In fact, I just received a clarification about that this morning. We really don't know what Nebraska is going to receive as far as these free KN95s, and we will definitely be alerting the public as soon as we get some actual information we can share.
All right, and one more from Dale. He said a new variant of Omicron is spreading, BA2. Any sign of it locally? Where have you heard it confirmed near Lincoln?
Well, I do know that we have it confirmed in Nebraska, but we have no confirmed cases in Lincoln, and we will be sure and let you know when that situation changes, just like we've done with all.
We have a question from the Omaha World Herald. Is it accurate that Nebraska basketball players who tested positive for COVID last week will have to wear masks during men's and women's games because of Lancaster County's local DHM, even if they had no symptoms and have since tested negative?
You know, I can't speak to any specific individuals about their current health situation, but there is, we have the guidance that follows CDC guidance about what people need to do when they're quarantined if they're a close contact, and that's to wear a mask. So I would expect that any athlete that's participating, those are the requirements that are set forth.
Hi Pat, it's Matt Olberting with Girl Star.
Hi, Matt.
Hi, hey, in terms of pediatric COVID cases, do you have numbers on how many there are right now at Lincoln hospitals, and then how that compares with, numbers in previous waves? Or
I'm going to have Dr. Pinkel talk to you because of her work with both Children's Hospital in Omaha and here. I think she can give you a much better answer.
okay.
Hi, Matt. That's a good question. Right now, I understand this morning we had 3 patients, the pediatric patients, in the hospital with COVID. That's about what we've had over the past few weeks, just a handful. This is more than we were seeing in prior surges. We really still had pretty low rates of COVID in the hospital. We'd have 1, maybe 2. We're definitely seeing 3 or 4 or 5. And have adjusted our unit even at Bryan so that we're able to have those negative airflow rooms for more patients and care for those higher numbers of patients.
And then there was some talk last week that possibly because Children's is so full that they were diverting like non-critical COVID patients to other hospitals, including hospitals in Lincoln. Have you seen that at all yet?
That's a good question. That's very true. We have taken many patients from Omaha. We work very closely with them and try to get those patients, as I talked about, kind of getting them the right care at the right time. We've been really trying to help those patients that are maybe not needing ICU level care or subspecialty care here in Lincoln so that they don't have to take up beds in Omaha. So those more sick patients we can then send to Omaha. So that is happening on a daily basis. Just this morning we got our updates on numbers, and Children's Hospital was full, did not have any beds available for admission in the general floor or the ICU.
Gotcha. Okay, thank you.
Mm-hmm.
Any other questions? Oops.
Yeah, Pat, I had one more question for you. I know you said that the Omicron wave is not peaking here, but just based on case numbers that seem to have kind of slowed down, at least compared with the last 3-4 weeks, do you foresee that that's coming soon and what you're seeing in test positivity and those kinds of statistics?
it's somewhat, we're being impacted by the lack of some of our sites being open last week. So wondering how that reflects. But just still looking at our hospitalization numbers, which are quite high. But we do anticipate that we will be peaking in our surge, hopefully in the very near future, possibly early or late next week, and then moving forward if we follow what's happening kind of nationally.
Okay, thanks.
Any other questions today? Okay. Well, I want to thank you again for joining us, and please remember to get vaccinated and wear a mask.